is Jessica DeMassa in the GuideWell Insights Lounge here at Singularity University's Exponential Medicine. I'm joined by Dr. Clay Johnston. He's the Dean of Dell Medical School at UT Austin. Okay, so welcome to the GuideWell Insights Lounge. Thank you for joining us.
Thank you. It's my pleasure to be here.
So I understand that you're speaking momentarily almost.
That's
and what
right.
are you going to be speaking about?
So I'm going to be talking about how the physician of the future, and then how we need to change medical school and the training in order to create that new model of a physician.
Okay, so what are some of the trends that are impacting physician education right now?
Well, for one thing, medical education hasn't really caught up with just the forefront of adult learning. So, the whole flipped classroom bit, small group learning, working with competencies, all of that. But the other is that we've really got to think about what the physician of the future needs to look like, and then design our training based on those needs. So it goes to looking at the healthcare system, saying what's wrong with the healthcare system, how can physicians contribute to fixing those problems,
Sure.
and then training for those skills.
So I know that the AMA just recently launched an innovation initiative to bring providers more into the fold in terms of driving innovation.
Yeah.
What do you think the physician role should be in terms of getting new technologies integrated into the health delivery system?
Yeah, I think too much physicians have been resistant to technologies and other innovations. And well, I mean, when you look at the technologies that we've forced them to use, who could blame them
Right.
for being resistant? But they have to not just not be resistant, but actually take control and help to guide the technologies and how they're introduced. So that's part of what we think is critical to training in the future. So it's more, it's the creative aspects of it. So design, human-centered design
Sure.
is a good example of that, but also entrepreneurship as well, and also looking at the entire system, not just the individual patient-doctor encounter.
Right. So we are here at xMed, right? And so they are talking about a lot of different exponential technologies that are going to be integrated in. So things like artificial intelligence and things like even blockchain, or some of the genomic technologies and things like that. From your standpoint, what are you excited about when you hear about some of these innovations that are coming down the pike?
Yeah, well, I'm excited about the whole array of innovations for sure. I mean, for me, we have a huge amount of data that we don't currently use. And we certainly don't use it effectively to improve care. So I'm particularly excited about how we collect data that really matters,
Sure.
and how we integrate it and analyze it in ways that can change the entire healthcare system. Some of that's not necessarily very sexy, but some of it really could be. So,
Sure.
for example, we're very focused on traditional kind of FoxPro relational database structures for data, whereas the data actually it's too messy to fit into that structure. So we should be thinking about different kinds of data structures, so Bayesian structures, which is really what medicine's built on, sort of Bayesian thinking, and yet our data sets don't reflect that we force data into a dichotomy of certainty which doesn't actually exist. So those are the kinds of things, and then you can layer analytics on top of that. So I think that's going to be a huge boom, and with great benefits.
So I want to wrap up with just one last question. So I know recently there's been a lot of talk about provider burnout, physician burnout.
Yeah.
So how can we mitigate that and move past that for a better future?
Yeah, so physicians are being asked to do a lot of things that they didn't sign up for, and that don't feel like they add value.
Right.
So documentation is the biggest one. Electronic health records haven't really made that any easier. In fact, they've made it worse. And most of that documentation is driven around getting paid, not having better outcomes for patients. Docs don't want to have to worry about getting
Right.
paid. They don't want to be transactional. They want to be about creating a great result for their patients, keeping
Sure.
their patients healthier. So we have to get the docs doing what docs are good at doing,
Right.
and peel off the stuff that is a distraction. So that's going to require a total rethinking about how this stuff
Shift in
works.
paradigm.
Yeah, so it's not, we have to reassess why we document and what needs to be documented. The processes for doing that need to change. If we can move to paying for outcomes, which I think is going to be the critical transition in the next decade, then we can actually reduce the burden of documenting just for the sake of getting paid, because we're paid based on the results in our patients, not on the what we did to them.
Right. Well, thank you. Thank you so much, Dr. Johnston, for providing that
pleasure.
perspective.
Yeah.
It's wonderful to hear from the physicians and the providers. Thank you so much for joining us. I'm Jessica DeMassa, and I'm here in the Guidewell Insights Lounge. Thank you for joining us.
Great.